Hi, I'm Amrita Chowdhury, Director and co-founder of Gaia. Gaia is an enterprise SaaS company. We have IoT and AI-based platform for transforming smart sites and smart cities. Today, I'm talking about how COVID-19 is transforming the smart city ecosystem. The pandemic has brought many things to the fore. Firstly, at one level, cities have been very successful in deploying existing smart city infrastructure and technologies. For example, cities that had already created an integrated control and command center, CCTV surveillance, GIS dashboards, analytical tools to go along with it, digital health kiosks, and other systems, have been able to effectively repurpose these solutions to address the emergency response needs of the city. At the same time, many cities, and it's been well documented by MOHUA, by the Smart Cities mission, have been able to work with technology providers, with agile startups, to create new digital tools and solutions, which have helped them in address some of the citizen-facing needs of the times. Now, secondly, the other thing that happened was that it came sharply into focus that several city functions and departments were manual, siloed, and continued to run on on-premise systems and servers which were not accessible remotely. So these cities, departments, and functions and the associated services with them were highly disrupted during the lockdown. So the thing that has come to the forefront is that there is a need to digitalize the last mile, the need to digitalize citizen services from the government, from the city government or the state government to the citizens. We as Gaia have also been able to innovate on this during the lockdown period. We've worked very actively with Agra Smart City and Agra District Administration. And, this we see as the next mile, the next need of creating hyperlocal and doorstep delivery of citizen services. As an example, during the lockdown, we launched the Sarvam platform. It's a cloud app and a cloud platform system, which enables cities to digitalize some of their services and are able to provide citizens a way to raise issues, requests, or complaints digitally, and for the city staff or their service providers to view those requests and to address them in real time or near real time, right? And these services could belong to any of the departments of the city, from utilities to records to maps to many more. And this could be regular services or it could be emergency response requests. So as an example, during the lockdown, working with Agra, we were able to deploy the Sarvam app and the Sarvam system for progressively for different use cases. First, in the very early phases of the lockdown, we enabled hyperlocal delivery of last mile citizen services and essential food items or essential medicines. This was in partnership with an ecosystem of hyperlocal ward-wise suppliers, aggregated by the city, but digitally enabled by this platform so that citizens could make requests and the service providers could service them. In the second stage, emergency response requests from citizens were fielded, and these could be in a variety of categories. Citizens might need medical health related a response. They might need to be transported to a hospital. They might need to report something in their area. They might need to talk about a violation of social distancing norms in their area, and so on. And all of this could be collected via the citizen app and orchestrated via the AI-based platform to allocate the task to the best available agent. And the agent was a city allocated approved volunteer who was going to help meet these citizen requirements. And in the latest phase of this, we're helping the city enable citizen utility services. These are water and sewage related issues and complaints which are being digitalized so that citizens can raise complaints and have a way of digitally engaging with the city. And the city is also able to manage digitally these requests and respond to them. So this really is the last mile, as we see, like, the next phase of digital government. Um, uh, Ministry of Housing and Urban Affairs is talking about it. NIUA is talking about it, that hyper local and doorstep delivery of citizen services needs to be operationalized. And these services could be utilities, land records, certificates, medical help, or any other thing that the city provides. The earlier phases of digitalization in smart cities focused on citizen to government payments. We could pay our electricity bill online, we could pay our water bills online. Now this next phase really needs to address the government to citizen service delivery and make sure that the city becomes citizen centric, right? That is the need of the hour. The need of the hour for citizens is to have safe, hygienic, livable cities where they have access to health systems, they have access to education, they have access to city services, all of it digitally enabled, real time, and that's the future. Thank you.